Duchenne muscular dystrophy. So what is Duchenne muscular dystrophy? It is nothing but it is most common hereditary neuromuscular disease. Okay, and the inheritance pattern here is nothing but it is a X-linked recessive, and the X-linked recessive, there is also the X-linked recessive deletion, and this is nothing but of the dystrophin gene, and this dystrophin gene is nothing but on the chromosome XP21. Next, moving ahead, looking at some of the clinical salient features. So this includes, there is a progressive weakness. There is progressive weakness as well as the developmental delay and the intellectual impairment. There is decrease in IQ, and then looking at toddlers. So in toddlers, there is nothing but there's delayed walking. There's delayed walking, and also the falling. Delayed walking, delayed falling, and well as toe walking, and there is also trouble running. There is trouble in running as well as walking. Trouble in running and walking upstairs. Now the common sites of the muscular hypertrophy. So the common sites include the calf, and calf is greater than the tongue, and tongue is greater than the forearm. Next, what we look at is the pseudo hypertrophy. So in case of pseudo hypertrophy, so this is seen of the calf muscles, and this is due to the fibrofatty replacement of the muscle. So this fibrofatty replacement of the muscles. Next, what we see is something known as the Gower sign. So what is Gower sign? The patient use their arms and hands to walk up their own body from the squatting position. So they use the arms and hands, and the squatting position due to the reduced weight. So this is due to the decrease in weight, reduced weight in the proximal muscles, and this is nothing but of the hip and the thigh, and this is of the lower limbs. Next, what we see is the Trendelenburg gait. So the Trendelenburg gait is seen, and or the hip waddle. Next, what we see is the inability to walk. There is inability to walk, and inability to walk, this develops by the age of say 10 to 14 years. Next, what we see is there's nothing but the complications. So the complications, it includes there is contractures, there is scoliosis, there is cardiomyopathy, as well as the malignant hyperthermia, and this is after the anesthesia. Next, there is also the occurrence of death, and this occurs by the third decade of life due to the respiratory failure. So Duchenne muscular dystrophy patients, by third decade, they have mostly seen that respiratory failure occurs. So just recapping what we have done. So what we saw is the Duchenne muscular dystrophy. So the important point being the X-linked recessive disorder. So it's nothing but X-linked recessive disorder. It is the most common hereditary. It's the most common hereditary neuromuscular disease, and X-linked recessive deletion of the dystrophin gene. So it's a dystrophin gene. Where is it located? XP21. And clinical features, just to name a few, it is there's a progressive weakness and developmental delay and intellectual impairment. In toddlers, there's delayed walking or falling, as well as in case of walking upstairs. And the common sites of muscular dystrophy, most common sites include the calf, greater than the tongue, greater than the forearm. The pseudo hyperdystrophy of the calf muscles are due to the fibrofatty. So it is due to the fibrofatty replacement of the muscle. Next, we looked at the Gower sign. It is Gower signs are present, and Gower sign is nothing but the patient uses the arms and the hand to walk up their own body from the squatting position. So next, we also saw the Trendelenburg gait. If you see the Trendelenburg gait, it is also positive, and it is present, and there is also inability to walk. The inability to walk develops by the age of 10 to 14 years, and then there's complications. What is this? There's nothing but complications. There's nothing but contracture scoliosis, cardiomyopathy, and the malignant hyperthermia. This is after the anesthesia. And then there's also death, which occurs by the third decade of life. This is due to the respiratory failure. Third decade, respiratory failure occurs.